Hi everyone, welcome to Nurse Brain Explain, where I will try to do my best to explain topics of nursing to help other nursing students ace the exam. So the topic today, we have RN, LPN, and UAP. This topic always gets talked about in nursing school, and I feel like they teach you about it in nursing 101 and then they just don't talk about it anymore. They assume that you know what to delegate when it comes to topics that they teach. So it's important to really to review these every single time you take an exam so that you don't confuse yourself and you for sure get those questions correct. If you have any questions or any comments or concern or any of these things have changed, please feel free to reply in the comments below and I will try my best to answer all of them with a timely manners. Okay, so today we will be talking about RN, LPN, and UAP. First thing is registered nurse, RN. We always teach only RN can do teaching, assessment, planning, and evaluating. Yes, this always on the exam. Teaching, assessing, planning, evaluating, always on the exam. If you see those terms, automatically think RN, automatically think RN. If it say, which one can do for RN? Anything with those words is for an RN, okay? These things on these columns are the things that they don't tell you. So these are very helpful when it comes to the NCLEX. So I got some of my notes also from UWorld. So I really hope that you pay attention to these. Anything with initial. Initial, for example, initial vital signs, initial patient education, initial assessment are for RN. Any of things like that is for RN. Initial is for RN. That's the keyword, initial, because RN will have to do everything initial so that she or he has the baseline. And when patient condition change, somebody report it to an RN. They know, oh, this patient condition has changed and this is what I'm gonna do. And they would assess and evaluate the situation and report it to the doctor. That's for RN. RN will admit and discharge patient. This is because nurses will have to do assessment and develop a care plan when they're admitting a new patient. That's nursing. That's for a registered nurse. They will also have to do discharge patient education. So again, admitting and discharging patient is only for RN. Care plans. Only RN can change plans and modify the care plans. Only RN can change plan and modify care plans. Blood transfusion. RN will initiate blood transfusion. Only RN can check vital signs 15 minutes after starting blood transfusion because most patients developed a reaction during this time. Again, vital signs after you start the transfusion, that 15 minutes after you start is very critical. Vital signs before you start blood, somebody else can take care of that. Vital signs after that 15 minutes, somebody else can take care of that. But within that 15 minutes of you starting the transfusion, you have to be there as an RN. Okay, blood transfusion will need another RN and only RN can co-sign verification of blood. Don't delegate that to anyone else. Only RN can do that. Only RN can initiate blood transfusion. Only RN can be there within that critical 15 minutes. Only RN will co-sign verification of blood. Next, psychological help. Any patient or family members that are showing signs of anger, if they are showing signs of anger or they feel like they're not getting the help that they need, give that to an RN to handle it. Okay, don't tell you if UAP come and report that to you. Don't go and tell them, oh, you do this. Tell family this. No, you go do it yourself. Calling other departments. For example, if someone has TB and they need this chest x-ray, you call that department and tell them, hey, this patient actually just got positive for TB or whatever disease they have. So you RN as an RN will call and tell them that. UAP will transfer that patient, but you're gonna inform those departments. Next, we have UAP, and it looks like it's not working. Actually, next we have LPN. I'm just gonna keep it like this. LPN, I want you to think of busy work, not dangerous work, okay? Think that they will help the nurses when it comes to busy work. So monitor RN finding. They can't do initial assessment, but they can monitor whatever assessment that RN tell them to. So they can monitor patient's bowel sound. They can monitor patient's vital signs. They can monitor patient's lung sounds. They can monitor any assessment as long as they don't do the initial assessment. Education, can they do education? No, but they can reinforce the education. For example, reinforce patient teaching about the use of incentive spirometer after RN did the initial education of incentive spirometer. LPN can reinforce any patient education as long as they don't do the initial assessment. Okay. The LPN can give PO, IM, SQ, and IV meds. LPN can give meds as long as it is not continuous IV meds and it doesn't require close monitor. Now, I have some examples for you. LPN can give oral and IV pain meds. LPN can give scheduled medication. Why? Because those are just busy work and they don't require close monitor. LPN can give SQ insulin, but they cannot give continuous IV insulin. Why? Because that requires close monitor, blood sugar, and titration. Okay. LPN are perfect for sterile procedure. Why? Those are just busy work, right? Catheterization, sterile dressing change, wound care, specimen collection from a Foley catheter, special collection from a Foley catheter. That is sterile. That's for LPN. Trach care. That's for LPN. LPN is perfect for anything sterile. Again, those are just busy work. LPN can check NG tube patency and administer NG feeding. Now that I tell you that, you're going to remember that, right? So on the exam, don't doubt yourself. Can LPN do this? Can LPN do that? Yes, they can. LPN can give NG tube, administer NG feeding. They can also measure the sequential compression devices. Why? That's busy work, right? They don't need to apply it. A UAP can do that, but they can measure that. But can they determine the effectiveness of that? No, that's for RN. Determining, that's evaluating, that's for RN. They can't determine if the SCD is working, or they can't determine if the SCD is working for the patient and things like that, but they can measure that, right? RN can tell them to go measure that, and they can tell UAP to apply that. All right, so let's move on to UAP. What can UAP do? UAP can do ADL. ADL, bathing, toileting, oral care, but not suctioning. Can UAP do suctioning? No. UAP can feed the patient, but not if the patient just had stroke in the last 48 hours. Remember this for the NCLEX. This was on my NCLEX. I can't tell you how many times it was on my NCLEX review. So many times. UAP can feed patient, but not if that patient just had stroke. Why? Because that patient is at risk for aspiration. Okay, that patient is not stable. You don't give UAP somebody who's unstable, because UAP cannot do anything with those patients. They can only report. UAP can do linen change, and I spelled that wrong. They can do vital signs. They can do input and output, and they can document vital signs, ISNO, meal intake, drainage of wound vac. Don't confuse yourself. Don't overthink. Yes, they can do ISNOs. Wound vac is one of the outputs, right? They can see how much drainage is that. They can document the drainage. They can report to the nurse, right? But can they assess the wound drainage? No. Can they monitor for wound drainage? No, right? So UAP can do what we call data collection. Things that are data collection, give it to UAP. They can report. The keyword is report, not assess, not monitor, but to report changes in condition. Report changes in conditions, such as the ability to eat, like if they have difficulty swallowing. UAP feed them, right? If UAP see that, oh, this patient is having difficulty swallowing, I need to report this to the nurse. They can do that, but can they assess? Can they be like, why does this patient have this problem? I'm gonna check this and that. No, they can't. Nurse is gonna do that. Next, we have repositioning the patient, such as elevating their limbs. UAP can help holding patient down during procedure. UAP can pick up and return things. What I mean by that is that UAP can pick up or return blood or meds to places like blood banks or pharmacy. So if the doctor is like, hey, if the nurse look at lab and she determined this patient needs blood, she's gonna call the doctor say, okay, doctor, make the order, and then the nurse is like, hey, can the nurse is gonna tell, hey, UAP, can you go and pick up this blood from the blood banks, please? UAP come over, give the nurse that blood, nurse verify with another nurse about the blood, and then the nurse is like, hey, this is actually a wrong blood. This is not correct. So then UAP can return that. Okay, same with meds. UAP can pick up, return things. UAP can transport stable patient and stable family members. What do I mean by that? UAP can transport stable patient to get chest X-ray. Okay, this patient's stable, get chest X-ray. Okay, it's just a chest X-ray, and this patient's stable, right? Let's go. But imagine if this patient is a med-surg patient, they go into the ICU. Their condition is getting worse, and they require close monitor, continuous monitor. That's for an RN to move them up to ICU. That's not UAP anymore. This patient is in critical condition. Okay, that patient's not stable. Now, what do I mean by stable family members? They can transport family members, such as like if a patient going to the surgery and family is gonna be waiting in the waiting room, right? So then UAP can help that, can assist the family to go to waiting room. But imagine if this family member is getting angry about whatever reason. Okay, you want the nurse to handle that. As I mentioned on a couple prior slides, I said, anything unhappy, give it to the nurse. Okay, safety. Safety such as placing better alarms for patient safety, making sure the room is free of clutters to reduce risk of fall, putting up signs for visitors to wear a mask before entering the room. Those are for UAP. UAP can check blood sugar. Yes. UAP can check blood sugar, but can they give insulin? No. LPN can give insulin. Can LPN do continuous IV insulin? No. RN will do that. You see the trend I'm talking here? I hope you see the difference between them. Okay, next we have applying sequential compression devices. Now, UAP applied the SCD. LPN can measure the SCD. RN will determine the effectiveness of SCD. Okay. We're talking about clean catch and midstream specimen collection. These are not sterile. UAP cannot do anything sterile. So these are not sterile. They can do that. But if it's from a Foley catheter, that's sterile. And sterile is best for LPN. Ostomy bag. Ostomy bag is sterile. No, it's not. So can UAP do it? Yes, they can. It's just changing an empty ostomy bag. Can they assess the stoma? No, they cannot. Can they monitor for the stoma? No, they cannot. But LPN can do that. Okay, can they report the stoma is turning blue? Yes, they can. They can report changes. They can't assess it. Okay, they can't assess the stoma, but if they look at it and they're like, oh my goodness, it's not pink and red, they can go and tell the RN, and the RN will come and look at it, right? The RN, if a UAP or a machine or whatever telling the RN that something is wrong, RN's gonna recheck by themselves. Okay, UAP go and tell RN something's wrong, RN's gonna go and recheck by themselves. Because that's their data collection. RN's gonna check it themselves to determine what to do. Anyways, I'm getting off topic. So next we have postmortem care. Postmortem care, what are they? They are removing IV, putting pillows under patient's head, cleaning the patient. Can UAP do that? Yeah, they can remove IV. Can they insert an IV? No, they can remove it though. So postmortem just basically cleaning patient and removing IV, and UAP can do that. Range of motion, any type range of motion. UAP can help patient with that. Remind patient to use incentive spirometer. They can remind and assist patient to do it, but can they educate patient of why they should do it? No, that's for RN. Okay, let's do some examples. Practice question number 1. The nurse is caring for a client in soft wrist restraints. Which tasks are appropriate for RN to delegate to UAP? Keyword for UAP. We have RN and UAP, and we have restraints, right? So selectively apply. I'll just give you guys like a second, and then please pause this video and then write down your answer, and then we will check the correct answer together. Okay, so pause your video. All right, so the answer for that is UAP can assist client using a bedpan, right? This is just toileting. This is just going to the bathroom. So UAP can do things like that, right? UAP can perform range of motion exercise. Even if patient has wrist restraint on, that's fine. UAP can help that. UAP can turn and reposition patient. They can elevate limbs, things like that. UAP can do that. But check pulse and sensation of extremities. That's required assessment. That's for RN. Observing skin for signs of impairment. That's for RN. Those are both assessment, and RN is going to do that. Okay, next question, number 2. RN is working with LPN UAP. RN, LPN, and UAP. We have 3 roles here, and whatever they're giving you in select of the applies, remember, we have 3 people. Each person, we're going to assign something. So if you think whoever does, if you think A is for RN or LPN or UAP, write it right next to it. You need to assign everyone at least 1 role. These questions, everyone at least 1 role, and you have 3 roles, RN, LPN, and UAP. So do this question now and pause the video. Okay, so the answer for question number 2 is LPN. Okay, so sorry, let me read this question real quick. Just in case if you're not actually watching the YouTube and you're just listening on your way to school, you can, you know what to pick. RN working with LPN and UAP. Client just returned from the cardiac unit after angioplasty with stent. Which actions are most appropriate for RN to assign to LPN? Select all the applies. So LPN can administer oral pain meds for clients' chronic back pain. LPN, what did I say? LPN is perfect for routine busy work, right? Pain meds, it's busy work. And it's just oral pain meds for chronic lower back pain. That's the keyword, chronic. Chronic has been happening for a long time, right? We're very familiar with this, right? And it's just a back pain. Pain meds for back pain, yeah, they can do that. LPN can do that. LPN can monitor for bleeding at the insertion site every 15 minutes. The keyword is monitor. Monitor is for LPN, right? LPN is for monitor. B, assist the client with the use of urinal post-procedure. This is perfect for UAP. We already said we're going to assign somebody with a role, right? Can LPN assist client to use urinal post-procedure? Yes, they can, but we have a UAP. We should assign UAP something, right? So everyone has their own job so that we can divide up the work, right? It's more effective that way. Think of it like that. So UAP can do that. UAP can assist client to use the urinal post-procedure. UAP can help them to get to the toilet, right? So that's not for LPN. So we don't pick that. Perform initial post-procedure vital sign measurement. Perform the initial post-procedure vital sign. You see vital sign, you're thinking, oh, UAP can do that. But look, initial vital sign, initial, that's the keyword. Initial is only for RN, not LPN, not UAP. RN will do it so that they have the baseline number. E, review ECG monitor for dysrhythmia. Reviewing ECG monitor for dysrhythmia. Review, that's evaluating, right? They look at the ECG, they see if it's actually dysrhythmia, so they will have to evaluate. That's for RN. So LPN, they can't do that. That's it for my 2 practice questions. If you want more practice questions, let me know, but I really hope this helped you. If you have questions, again, go to the comment. That is where I will check if people have any questions or any comments about this. Thank you so much. I hope you will pass nursing school. Yes, you can. You will pass.